All right. Well, thanks, Hannah, for coming. Thanks, Tammy. Hold on. Tammy's texting me. Let me see what she's saying real quick. So thanks for coming today. Yes, Tammy, you're good to go. Thanks for being here. And we're excited just to tell you more about this, Tammy, because this and Hannah, because this will definitely help some quality count centers as far as getting their name out there and just helping with referrals and hopefully wait lists and such. So Andrew, who are you doing slides or I'm doing slides? Or is Amelia doing slides?
Yes, I've got the deck pulled up, so I'll move it along for us.
Perfect.
Hey,
so
Hannah.
As you know, I'm Caitlin, and I'll go ahead and let in just a minute Andrew and Amelia introduce themselves as well. But Tammy, do you want to go ahead and tell them your role at First Steps?
Okay, so all this new technology here, I'm trying to make sure I have everything right. Yes, I am Tammy Compton. I'm the program director for quality counts at Spartanburg First Steps.
And Hannah, if you're there, do you want to tell us your role at United Way?
Yes, hello everyone. I'm Hannah Jarrett. I am Vice President of Community and Collective Impact with United Way of the Piedmont, and I'm excited to be part of this conversation and session today.
Perfect. I still see a few more coming, so we'll hold on for just a minute. Hi, Lakeisha. We were just doing some introductions. Do you want to go ahead and, I know you just hopped on, but do you want to tell them what's going on over at NDG?
Oh, wow. So hi, everyone. Lakeisha Whitner with the Northside Development Group, also known as NDG. We will be conducting our Start Me graduation the first Saturday in May. So it's 15 Northside residents that will be pitching their businesses on Saturday, May 7th. And then on Saturday, May 14th, we will also have a group of young people who have gone through college conversations where they've gone to 6 local institutions of higher learning. And they will be awarded, we will be awarding 2 $1,200 scholarships from the North Side. So I don't know what everybody shared, so I'm going to just leave it there. Thank you.
That's great. Amelia, you want to keep it going?
Yeah, hi everyone. My name is Amelia Wilkes, and I'm the Community Relations Coordinator here at Children's Trust. If you guys have participated in Child Abuse Prevention Month, you've probably seen some emails come from me. But I also work directly with our parent-focused website, SC Parents, that houses a resource network database powered by Find Help, which you'll learn a little bit more about today. And I'm super excited about this resource being used in Spartanburg. So thank you, Caitlin, for bringing us all together. And I'll pass it to Andrew.
Perfect.
Hey, good morning, everyone. I'm Andrew Noblick. I am a community engagement manager with Find Help. And as Amelia mentioned, we are the network that powers SC Parents, which is the platform we'll be going over and reviewing today. So again, thank you to Caitlin for bringing us all together. My background is in the public sector. I've worked in the secondary and higher education levels and in local government. And I'm based out of Charlotte, North Carolina. So just a hop over the border from you all, but I'm excited to be with you today.
Perfect. And I see Angela real quick. So Angela, I'll give you a quick second if you want to hop on and introduce yourself. And if not, that's okay as well. And we'll keep moving.
I am sorry, I have been trying to get on. Hello, everyone.
You're fine.
Hi, I'm Angela Robinson with Hope Center for Children, the program director for Triple P.
So perfect. Real quick, just to kind of give you a little bit of background on how we even got here. So as most of you are already familiar, Hello Family has recently launched in Spartanburg. Most of y'all are either already participating in it or know pretty much a good bit about it, but I will just kind of give you a quick little overview. Hello Family is, we've received money to expand existing services in Spartanburg. And so that's part A, but part B is also a hotline for families to connect them with local resources. So part of one of those resources we've been utilizing is scparents.org, which is part of and hosted by the Children's Trust of South Carolina, who also was already participating as a partnership, as a partner in some of the areas to get Hello Family up and running. So that's kind of how we've come together. That's how Amelia and I kind of partnered and kind of got rolling with things over here. So yeah, any questions on kind of how that works or where we're even coming from? I know, Andrew, I'm fast paced, man. I just keep on going.
I love it. I love it. Hey, we're ad-libbing here, so we'll keep it moving along.
So again, because everyone here already knows about Hello Family, we'll keep it moving.
So I will speak a little bit about Children's Trust and mainly on the SC Parents side of things. So Children's Trust as an organization, we promotes prevention and increased child and family well-being. And one of the ways that we do that, and of course, enhancing coordination between organizations. And so one of the ways that we've did that is we've invested into a parent-focused website, scparents.org, which we will take a deep dive into in a few moments here. And I'll drop the website link in the chat in a few so you guys can follow along. But one of the ways that we see that we can prevent child abuse and neglect is make sure that families across the state are able to find the resources that they need to be strong and thrive in South Carolina. And so that is how we have teamed up with Hello Family. And so I will toss it to Andrew so you guys can learn a little bit more about SC Parents and the resource that is housed on the website.
Yeah, thanks, Amelia. So I went ahead and dropped the link to SC Parents in the chat. Please feel free to pull that up and follow along, and we will give a brief demonstration of how the SC Parents site works and how we are enabling South Carolinians to get connected to the resources that they need when they need them with dignity and ease. And that's a big component of what we do at Find Help. And we're really fortunate to have this strong partnership with Children's Trust of South Carolina, and excited to share it with Hello Family partners today in order to better serve South Carolinians. So what exactly is SC Parents? Well, it is basically an online directory of free and reduced cost services. It's the largest national social care network available digitally in the United States. It's an electronic referral tool. It's accessible to anyone, anywhere across the United States at any point in time for free. So we don't restrict who can access the network. It's as simple as conducting a Google search for services, and we'll highlight how our users navigate the site here shortly. And again, it's powered by Find Help. And as a employee and stakeholder with the organization, I'm just very excited to be here to share this with you today. So who are the primary user groups of SC Parents? They're comprised of what we call seekers, folks who are looking for support and navigating the social care network, helpers, so folks like yourself who are supporting individual seekers and navigating the complexities of looking for care, which might include healthcare, social care, workforce development programs, food, housing, et cetera. And then community-based organizations are also using our site to manage their programs to ensure that folks who are looking for support are aware of their programs and their eligibility to access those services. So one of the biggest things I want to point out here about SC Parents is that it's, like I mentioned, an open network. It's available 24/7, 365. So stakeholders who are maybe in need and they decide at 3 a.m. they're sitting in front of the TV and they're recognizing that they may need food for the upcoming days. And so they have the ability at that point in time to hop on to SC Parents and navigate and search for programs that might be able to serve their need. Privacy is at the heart of what we do as an organization at Find Help. And as such, the SC Parent portal and platform is HIPAA and FERPA compliant and is high trust certified. So that's the highest industry standard for security measures in a virtual platform of this kind. And then we have a lot of flexibility in terms of how organizations utilize our network. And we'll dive a little bit more into that here on this next slide. So organizations use our platform in a variety of ways, but once organizations claim the programs that are listed on the site, they have access to a free suite of tools, which enables our partners to manage their program listings, create a network of employees that are affiliated with their site to collaborate on the site. You also have the option of selecting from a variety of screening and referral intake tools, such as appointment tracking, screeners, assessments, and more. And then there's a really powerful analytics and data suite on the back end that really enables a lot of our nonprofit partners to be able to show their impact to their stakeholders, which might include board directors or funders of specific programs. So it's a really great and free tool for our CBO partners. So organizations use the platform in a variety of ways, but these are kind of the four primary buckets in which we see organizations leveraging the platform, and they include learning about the various programs that are offered, learning about those organizations and how they're operating, joining the network by posting or claiming their organization information and program information, connecting with individuals through the platform. So that might include making or receiving referrals through the platform, and then supporting the growth of the network. And Amelia will touch a little bit more on how we might ask you to do that in the future. To get started, one of the most important ways that you as an organization and stakeholder within your organization can make an impact in our ecosystem in the network is by claiming your program. And this enables you to take ownership of that program listing. So at least as far as I could tell, I think everyone here in the call today already has a program listed on the SC Parent site. The next step, if you haven't done so already, would be to claim that program. And that again gives you access to the full suite of tools that we highlighted. And it gives you the ability to manage and update to ensure folks are aware of the services you're providing and their eligibility to access those services. Some of the primary benefits of claiming are, of course, that you have access to the free suite of tools. An unlimited amount of folks from your team can claim a program, so that would enable anyone on your team to take charge and become responsible for updating information, which could be your location, your hours of operation, the stakeholder groups that you're serving, eligibility requirements, intake tools, etc. And the program tools that you might choose to use across the platform might vary depending on your workflow, and we take the approach at Find Help and SC Parents that there's not really any one right way or one right tool, and it's really about fitting into your current workflow and operation. If you have things that are already working quite well for you, we're not looking to reinvent the wheel, but we do want to ensure that we're providing the support that might be beneficial to you. So Amelia and I are available to consult on current workflows and how you might be making referrals or receiving referrals from stakeholders across the Spartanburg area. All right, so now I want to hop into SC Parents and do a brief demonstration. But before I do that, I would welcome any questions. I know that was a lot of information I just threw your way. So as I get the site pulled up, please feel free to either come off mute or chat any questions you might have. All right, I'm going to ask Amelia, can you shout out a zip code for me to use, or anyone? If I see a zip code come through in the chat box, I'll be glad to pull that up first.
29306.
All right, I got
It's a safe bet.
I got Hannah in the chat, Caitlin.
Oh, good.
29301. So I'll pull that up.
Even better. It's all city.
So at the SC Parent site, you'll come to this landing page, which is a great white label landing page for SC Parents. And basically, stakeholders can begin their search with just a zip code. So it's a very simple way to begin a search for services. So South Carolinians can come to this site. They can simply enter in their zip code and hit search. And what that's going to do is going to direct folks to the landing page for that particular zip code on SC Parents. And we'll see here that there's a variety of programs that are, or program categories. We'll also see that there's nearly 1,700 programs listed in that particular zip code. And so residents in 29301 would have access to being served by those nearly 1,700 programs in the Spartanburg area. So one thing I want to point out here is on this landing page, there's the option to sign up and create a login. However, as you can see, it's not a requirement in order to navigate and use the site. So the benefit of signing up for an account is that it allows individual seekers to track their referrals, and it allows those individuals who are helping seekers to navigate social care programs to also track the referrals that are being made. And then organizations would have access to the free suite of tools if they claim their program and create a login. So this is where you can create your login. If you've not yet created one, you'll see that it's quite simple to create a login. You can do it with, if you have a Google account or Gmail, you can have kind of a single sign-on approach with Google. You can create a username and a password. You can also choose to use a phone number and a password as opposed to an email. So with this in mind, we wanted to kind of limit the barriers that might exist for individuals who may not use email, have access to email. So phone is an option as well. But once you've created your login, as a program, you can again claim your program. So that's kind of how you take ownership of your program listing, and then you can begin to manage all of the information affiliated with that program. So you can do that through the bottom link at the bottom of the page there. It says claim programs. And I'll drop this hyperlink into the chat too, if you'd like to go directly to that page. But essentially what you could do here is you could, we have the United Way here today, so I'll go ahead and type in United Way, but basically you would indicate the program or agency you work for in the zip code. So we'll enter 29301 again. And we can see here that United Way of Piedmont, we see the mobile meals weekend program. Trying to see if there's any other listings there. So basically, if we wanted to claim this program today, I'm sorry.
Where did this pull from? I'm just curious, like how is this being populated?
Yeah, that's a great question. So this is actually representative of the programs that are in the network right now. So these programs are listed in our network. And the way that programs become listed in the network are either through the Find Help curation team. So we have about a third of our company consists of a data curation team, and they are working tirelessly to work with programs and get them added to the network. And so a program will be listed on our network and available for stakeholders to find out more information about how to get connected with those programs. So that's one way that programs are added to our site. Another way is just individual community members, affiliates of organizations may choose to ask for their program to be added to the network. And so that can also be done in a similar fashion to how you would get to this page, through the claiming page. There's a way to suggest a program, and through the suggest a program button there at the bottom, folks are able to, and I apologize, my Zoom, there we go. Okay, so you could actually suggest a program through this page. And so that's one way that programs also become listed on the page. Does that answer your question?
It does. I typed in United Way of the Piedmont, and the 3 programs that come up that say that are provided by United Way of the Piedmont are not, which was why I was asking how it's populated. And then I understand the claim, and I haven't clicked on that yet, but if it is a situation where it's being like misrepresented, how do we go about fixing that? And again,
yeah, that's a great question. So that would be again through the suggest a program key. So okay. That can be done. So if you see that any information is inaccurate on the site, and our team does work to continuously to try and make sure that information is as accurate as possible. As you can imagine, with hundreds of thousands of listings, they don't always get it 100% right. So that's why we have the suggest a program button here. And this is actually where those program edits can be recommended. So we could add in United Way, and then the state, and once I hit search, it would take me to an additional set of fields where I could make recommendations for changes that way. And then also, I'll point out, if I go back here to United Way, of Central Piedmont, you said, or of Piedmont?
United Way of the Piedmont.
Of the Piedmont.
Yeah, so those top three there are saying, those are all programs that I'm aware of. Like, we fund Union County Pregnancy Center, but we don't, Union County Pregnancy Center would be the agency. So again, I just wanted to know the process for editing and
so that would be one way to suggest a program, and then you can also click on these program names, and there's another way to suggest an edit to the program. So once I'm on this card here, there's down toward the bottom, you can see that this entry was last reviewed on September 1st, 2021. Our team does work to review each program card semi-annually, or twice a year, every 6 months, to ensure accuracy. But if you're noticing discrepancies, you can hit the suggest a change button, and that would take you to a field, a text form where you could submit that information and that inaccuracy. So so that's a pretty streamlined way to take care of that. But yeah, great question. Thank you for bringing that up. And
and it looks like all the other information, like when you click on it, is correct. It's just the top,
Gotcha. So really, so what I hear you saying is this should be the organization as opposed to United Way. Is that correct?
Well, it looks like two individual organizations and programs were somehow combined into one. Like, there needs to be Union County Pregnancy Center organization and programming, and then United Way of the Piedmont. Somehow they got linked. But yes, this information is very helpful and makes sense, everything that you've shared.
Okay, great. And if you have any issues getting that submitted, or don't see those modifications made after you submit them, usually our team tries to make those changes in 48 hours from a submission being made. So if you don't see those changes taking place within several days after submitting a change, you're more than welcome to reach out to me directly and/or Amelia, and we can definitely work on making sure that is correct information, because that's what we want. We want stakeholders to be able to see so they can access the program seamlessly. So once the information, assuming it's correct, you can go in and claim the program here. I'll say too, once you take ownership of your program, you can go in and you can make modifications to your program name too. So if folks are affiliated with these particular programs, they can claim them, and then they'll be able to go in and modify the program names and those elements of that program listing as well. So that's an alternative way to go about it. But what I would like to do is sign in, because I want to demonstrate what that looks like. Oops. Let me go ahead and do this here. Okay, so now I'm logged in. So this is, once you create an account and log in, I'm logged in, and I have affiliated programs with my account. So I can see here that I have a variety of program tools that I'm able to access. As I mentioned, the inbound referral management system, I can manage a calendar for folks to set appointments. I can manage those appointments, edit my program's listings, and then manage my team information. So if I have a team of folks, care managers who are making and receiving referrals, this would enable me to assign various referrals to those particular team members. Team members would also have access to managing the program listing, et cetera. I'm not going to deep dive into any of this, but I just wanted to highlight this at a high level to overview what you would have access to once you claim your program and have programs affiliated with your account. But to use the site, getting back to navigating the site as both a seeker and a helping professional, once I'm here at this landing page, you can see that, again, there are nearly 1,700 programs listed. There are a variety of categories that are listed here. So if I know the name of a particular program, I can enter that in the search bar up top. If I just want to explore by category, let's say I'm a helping professional that's working with Sally Seeker to find some housing support. I can go to this housing category card, and then there are subcategory cards or listings here. And if I'm working with Sally and I know that she needs some help paying for housing this month, I may go to the help pay for housing link. I'll see that there are 74 programs that are available to Sally in Spartanburg. And I can click on that, and then it will populate a list of all 74 programs available for Sally to explore. So this is where we'll see the program cards. Will be 74 program cards representing every single program, every single one of those 74 programs. There'll be a map denoting kind of the location of those programs. I can see an overview of what those programs have to offer, the main services that are available, and the populations that are being served through that particular program. I can see next steps for how I can get Sally connected with that program. And then if I want more additional information, I can expand that more information drop-down tab to see eligibility requirements, the availability of the program. Some of the options that we might see here would include that the program's available. They might have run out of funding. They may have a wait list right now. So it gives us a good idea of whether or not Sally will be able to access this program right now when she needs it this month. And if I wanted to make a referral on behalf of Sally, I wouldn't be able to do so. This is the connect button. So if I click on see next steps, it's going to direct me for this particular program to the program's website. This is what the program's stakeholders have indicated as the best way to get connected with the program. I can still log a referral in the system if I just want to track the outcome of my referral for her, but I won't be able to make a direct referral through the platform for Sally. And I'll demonstrate how to do that on another program card here in a minute. But I do want to point out too, if I know that the Spartanburg Housing Authority is a program that I'm going to make referrals to often, or if Sally and other clients with whom I work often have a need for housing support, this might be a program I would want to save just for easy access in the future. And once I save a program, I can store it into a folder that will then be stored under my my saved favorites at the top, so I can quickly access any favorite programs I have, just to streamline the process, so I don't have to go through the process of selecting a category, subcategory every time. So I can create a new folder. I can pick an existing folder if I'd like to, and then save that. And likewise, I can, apart from hitting the save button, I can click these check boxes next to these programs, and then it will populate similarly to an Amazon shopping cart. And then in the same way, I can either save these, I can email them directly to Sally if I want to give her some different options to choose from. I can print them if Sally's in my office and maybe she doesn't have access to email. I can print them and hand her a physical copy of them. So there's a variety of ways to get this information out of the network and into the hands of folks that are seeking care. And that's really what this is all about, is making it as easy as possible for folks to access these services. And part of our mission is to allow folks to seek support with dignity. And a part of that we feel is giving the ability for folks to receive a response to the referral. So when a referral is made, and I'm not going to demonstrate it here because these are live programs, so I'm going to actually pull up one of my demo programs to show you what it would look like to make a referral. So these are some of the saved programs that we have. These are just demonstration programs, but you can see here that there are some different intake options that these programs have. One is to apply through a screener. So this gives one additional layer to ensure on both sides that it's not wasting a seeker's time to pursue support from a program they may not be eligible for, but it also helps organizations to streamline the process of working with folks who are eligible for services. So a screener is a great way to do that. And then alternatively, there's what we call a one-step referral, where folks can just, if I'm helping, again, Sally here, I can refer Sally. I would enter my name. It's already auto-populated because I'm logged in as myself. And I could, I've never worked with Sally before, so I would need to enter her information here. And I don't need to enter a phone number, but I could. I'm going to leave that blank. I'm just going to indicate that email is the best way to reach Sally. I could enter a comment if I know that Sally works during the day, but she has a break from 12 to 1. I could say a contact between 12 and 1 is best, and this would let the organization know that that's a preferred time when Sally can be contacted. And then this is really important, and it goes back to our high trust certification and HIPAA and FERPA compliance. We have a per referral consent model through SD Parents and at Find Help. And so for any referral to be made, we require that the person being referred gives their consent to be referred. And that is for each and every referral. So we don't have an all-in consent model where someone would just blanketly accept that any and all referrals could be made. And so that's really important. So again, in order to make this referral, I would just hit send. And then that would go into the inbound referral dashboard. Once that referral is made, an email will be sent to the organization, to the individual who's being referred, as well as the person, the helper, myself, who's made the referral. So that gives us a really great way to track the referrals being made and to respond to those referrals. It essentially creates kind of a three-pronged approach to managing that referral. So beyond that, well, I guess I do want to mention that once a referral is made, I'll see that Sally's referral is in the people I'm helping dashboard. So this is a dashboard where I can manage and track all of the referrals that are being made. And then I can click on that. I can update it as the individual who's working with Sally. So if I know that Sally got help, I can update the fact that she got help from the employment training organization. And likewise, if she didn't get help, wasn't eligible, or was referred elsewhere, I could update this. Sally would have the ability to do this through her dashboard, as well as the employment training program. So I'm going to go ahead and just indicate that she got help. And now that's noted, and that loop is closed, and that will be tracked in our data dashboard that's available to organizations. So I also want to make mention of the favorites folder. So going back to that, this is another really great way to share out with your team. So you could list out a variety of programs offered through all of your partner organizations across Spartanburg. So if you have a coalition, if you have a number of housing programs that you operate with, You could, again, create a shared folder. You can share those out across your team. You can print them. You can email the folder to stakeholders and organizations. So it's a really great way just to quickly aggregate different programs and get those shared out. So I know that we're coming here to the lunch hour. So I want to just, again, quickly review. So to begin your search on SC Parents, you'll simply enter a zip code. You'll come to the landing page. You'll see a variety of categories. This will be your starting point and any seeker or navigator starting point to seek out the variety of programs that are offered in any particular zip code across the state of South Carolina and nationally. Once a referral is made, those are listed under the dashboards, either through the People I'm Helping dashboard, and if you're an organization, you can manage those through the inbound referral dashboard. There are a variety of different tools available to organizations, and I'll note too that we do provide additional training to organizations, both through Find Help, and Amelia has some sessions as well that will be scheduled later on in the spring for nonprofit organizations in South Carolina to learn more about how the suite of tools can be utilized and incorporated into your workflows. You don't need to register or sign up for an account in order to use the site. However, if you are a navigator acting on behalf of someone, it is for the optimal experience, it's encouraged that you would create a login for that. So that's SC Parents in 15 minutes, 15 to 20 minutes, but I'd love to field any questions or feedback that you might have. I know we've already had some great dialogue about how to manage programs and update programs if we're seeing some inaccuracies there. Are there any questions that you all have about how to navigate and use the site?
I have a couple other questions, but I know that I've already asked questions, so I don't want to hog the time. So I don't know what else is on the agenda, or if anybody else has questions.
You're welcome to fire away, Hannah.
Okay, so how, if at all, is this integrated with 211? Are you familiar with the 211 systems that exist across the country?
Yes, absolutely. So 211 is a partner of ours. So, you know, we work in tandem in many ways with 211. 211 does not have a digital virtual component, but you know, so we kind of fill the gap that way, or Find Help and SC Parents kind of fills the gap that way. Did you have a particular question about the working relationship with 211?
Well, it just seems to be that there's a lot of duplicative information, which is great. Multiple ways that people can find information, because we know knowledge of resources and services can be people's #1 barrier to getting the help that they need. But thinking more from the agency perspective of all the different systems that they have to keep updated and keep an eye on and check, just wondering about how this is aligned with systems that maybe they're already using, and then, or what are, if any, those opportunities to create more integration into things like 211 and SC Parent, where there is a little bit of overlap. Again, I think that it's great, and because it's just another way to get this information into the hands of the people who need it.
Yeah, so the way that we work with 211 is, you know, I think it's mutually beneficial in that it kind of helps to extend the reach and deepen the impact in communities. And in a lot of ways, I think we just give an additional entry point, you know, through SC Parents. I think in a lot of situations, it can be challenging and cumbersome to kind of navigate. And so this gives really that direct access to having a more, what's the word I'm looking for? I guess, anonymous way to kind of seek and search for care. If I'm an individual who may have something sensitive I'm dealing with and need or want to manage, or at least explore solutions independently. I think in some ways, SD parents can be that method through which, or that platform through which individuals can start to seek care on their own without having to self-identify. But we do have an entire page about we have a web page about Find Help's relationship with United Way and 211 specifically. But Amelia, I don't know if you have anything you might want to elaborate on in terms of relationship in South Carolina specifically.
Yeah, so Hannah, to I guess answer your question, there's no current interoperability between United Way in South Carolina or 211 United Way in South Carolina and SE parents. However, I do know Find Help does power 211 in other states. So that's just not a thing that is in our state. I think, yes, there are a lot of platforms. Each one is a little different. Ours is very open, but like, again, we don't really care how people find help as long as they find the help that they need. And this is just another door. I know for our partners, this is what we push. So of course, whatever is on here, we want all the information to be accurate. And I think that's really the extent of that. If that's any more helpful than what any additional answer than what Andrew said.
No, that is helpful. And I was just curious if there was any integration for that very reason. Just because I know in systems like this, quality information in means quality information out.
Right.
And so related to that, I guess a little bit, another question that I had is, how do you promote or reach out or connect with agencies to make sure that they know about this, that they are updating their information, that they're using the platform? How is that being promoted and what type of training is provided?
Yeah, so that also kind of segues into, I guess, Andrew, you can exit out the demo. So we can see the slides, but I'll start with how we promote it at Children's Trust. That's through all of our funded programs. So Triple P, Strengthening Families program, and our home visiting grantees. We share it with them. And then of course, any other partners we have externally, especially through trainings. Our training team promotes SE parents whenever they do ACE trainings or whatever trainings they have going on that month. Another big push that we did for this is Child Abuse Prevention Month. That is a very big thing, as I'm sure many of you have heard of it. It's working in the space that Children's Trust does every year. So in our almost 200 partners that we had for Child Abuse Prevention Month, each partner was able to receive SE parents materials. I have some near my desk. If they're reachable, I would show them to you, but Caitlin will have some for you guys to get from her in Spartanburg, since she is much closer to you than I am. So those are just a few of the ways that we've done just this year. And of course, like other ads and stuff, just like where people who would ideally be using this resource would be finding it. And that just comes with relationship building with organizations such as like Cooperative Health that we've worked with, and churches and things like that, where they are pillars of communities outside of folks like us that work directly with children and family in such a very niche capacity every day. And then in terms of your second part question, how can people learn more? So like Andrew said, we do have we have other trainings that we typically have them on our SE Children's website, which I will, oh, thank you so much, Mimi. Mimi has dropped the link. So that's usually updated, and that has the 101 training, which is very much, I want to call it like the basic training, where you can get like a quick review of the website, which is really good, especially for your colleagues that are working with you who were not able to attend today. It's really good for them to view that one just so they can see how the platform works. And then we have the 201 training that goes more into the free suite of tools that Andrew mentioned at the very beginning of the presentation. Does that answer both part of your questions? Am I missing anything? Okay, perfect. I think I saw something come through the chat. Maybe I didn't. Okay, so just as a wrap up, so like I said, these are our SE Parents postcards. They're very easy to hand out to families, especially because I know that all of you guys cannot be the one-stop shop for everybody, of all the people that you work with. So in addition to sending people to Hello Family, if you have a SE Parents postcard, feel free to hand one to them. Caitlin will have them. I will be shipping them up to Spartanburg this week. So I'm sure she'll let you guys know when they are in her possession and figure out logistics on how to get them from her up in Spartanburg. Like I said, we also will have trainings on the SE Children website. So continuously check our events page so that if a coworker of yours that wasn't able to attend needs to learn how to do this whole thing, feel free to send them to a training, but also we will send out a recording of this via a YouTube link so that you can also share that as well. And one thing I do want to touch on is the simple search box. So on separents.org, you all have received the link. You saw that there was a search box that Andrew typed in the zip code for. You can put one of those on your website if you'd like. People can access SE Parents directly from your website by just typing in their zip code. I know a lot of our partners recently have really been liking it, mainly because it's very little work on their end and makes a big impact. We just develop the code and send it your way. You can put it on your website and there you go. You've checked off the box that way. And then of course, in our follow-up email, we will send out 1-minute video tutorials just in case there's something that Andrew covered or that we've mentioned that you just want to review really quickly. There's 1-minute videos to cover most of the information that he has talked about today. Do I have any other questions of anything that I just mentioned? No? Okay. Well, this is my contact information. If you have any questions, you'll have it because I'll be sending out the follow-up email. But feel free to ask any questions if you have any questions about anything Andrew covered, or if you want us to do another condensed version of this or talk about anything with a set group of people like Caitlin has done with you all, please let us know. We're happy to do that, or happy to come up to Spartanburg to do it in person if you guys prefer. So please just keep in contact with me and I'm happy to be as helpful as possible. And I'll pass it to Caitlin to close us out.
Thanks again so much for taking time to come today. And just one reminder I want to pass out is the big why, as why is Hello Family promoting this? And there's a couple of reasons on that. The importance of claiming programs is because a lot of you who are already aware of Hello Family, you know we're promoting this on our website. So in order to meet parents where they're at, yes, they can call us, but we also have this link so they can find help at any time, which means if they don't connect with one of us live, this might be their only avenue to find help. So I know the biggest thing I'm hearing lately while I'm making my community rounds is I just don't have the staff. So just remember there's different ways this can work. So even if you don't have the staff right now to add in another avenue of incoming referrals, remember by still claiming it, you're still getting your information out there for somebody to call you. So it's important. Tammy, I know like Maximum Learning is already on there. I've already looked at it. So that's one way for parents just to locate all of those child development centers and kind of see what's available to them. So the other aspect of this is we are pushing a lot of families 5 and under Hello Family, and our Hello Family team uses this. So while we try and know what's out there and we try and stay on top of it, we use this when parents call and they're asking for something specific that we're not aware of. We're going to the same site and using it as well. So it just helps all of us stay in the know as far as what's happening and how to get in contact with someone quickly. So the biggest thing I can encourage today from the Hello Family aspect is to go on there and claim that program so we can all make sure everyone's getting the help they need. Again, I'll touch base with everyone individually once I have the materials from Amelia, and I'll check in with everyone. If you have any questions, you can reach out to them. You can reach out to me, and we just appreciate you taking the time to be here.
Thank you guys, and I'll stop the recording now.
If there's no other questions, enjoy lunch.